Right now at 11, trying to find a solution for surging COVID hospitalizations in the city. And tonight, a potential new pandemic threat. What you need to know about Flurona. Good evening. I'm Christine Johnson.
I'm Maurice Dubois. The term that's gaining traction is being used to describe a co-infection of COVID and the flu.
The double infections have doctors concerned about a twindemic and its impact on an already overwhelmed hospitals. This as New Jersey broke its daily record of positive COVID cases today with almost 32,000. In New York, there were almost 78,000, and in Connecticut, about 10,000. CBS 2's Jessica Layton live now on Manhattan's West Side with more. Jessica.
Christina Maurice, New York City Mayor Eric Adams says the past 2 years have been full of fear and fatigue. We all know that, but perhaps nobody knows that better than the doctors and nurses who've been coming to work at these hospitals every day. And tonight, the mayor says we need to do more to give them all what they need.
The city is seeing a COVID caseload that's unprecedented.
Over 30,000 cases a day on the 7-day average. And we are seeing the impact in our hospitals. About 75 to 80% of all hospital beds across New York City are occupied right now. And that number we do expect to increase.
So the mayor is pumping up the resources before it gets worse. That includes $111 million to help city health and hospitals address staffing shortages.
Doctors, nurses, medical technicians, and support workers.
And adding workers at the Department of Health. Governor Hochul addressed the latest wave of the crisis in her first State of the State, recognizing the physical and emotional toll taken on the heroes who are still on the front lines.
That exhaustion, combined with pre-existing staffing shortages, has resulted in a crisis.
The consequences can be disastrous.
Immunologist Dr. Purvi Parikh is talking about another potential threat facing healthcare facilities right now, Flurona, the combination infection of flu and coronavirus in a patient at the same time.
Here we're looking for influenza A, influenza B, and then SARS-CoV-2.
It was confirmed this week at a testing site in LA County in a young man under the age of 18. But doctors in the tri-state area say they have no doubt there are cases here too. Dr. Parikh says if you're sick, you should ask to be tested for both viruses.
Our biggest fear is a twindemic. A twindemic means that there will be a lot of COVID cases, a lot of flu cases, and those overlap cases too are possible.
And remember, the flu season usually goes pretty strong until May or so it's not too late to get your flu shot or your COVID vaccine. Live on the West Side tonight, Jessica Layton, CBS 2 News.
All right, Jessica, thank you.